This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello and welcome to the Neurology podcast. This is Halley Alexander from Wake Forest University, and today I'm here with Valérie van Hezik-Wester from Erasmus University Rotterdam. Valérie has studied the effectiveness of seizure dogs for drug-resistant epilepsy, a topic which actually comes up quite frequently in clinic and for which I personally have struggled to advise patients on due to a lack of evidence and guidance from the literature. Valérie and her colleagues have recently published their findings in Neurology on the effectiveness of seizure dogs in epilepsy. So Valérie, I'm really excited to hear more about this today. Welcome to the podcast.
Thank you for having me, Ali.
So can you start by just telling us what is significant about this study in terms of what it adds to our understanding of seizure dogs for people with epilepsy?
Yes, sure. So as you just already mentioned, there's a lack of evidence. So our understanding on the potential of seizure dogs largely relies on anecdotal evidence or exploratory retrospective studies. So our study is unique in that it's the first attempt to investigate the effectiveness of seizure dogs using a randomized design. So the trial was specifically targeted at patients who've essentially exhausted all available treatments and still content with frequent seizures. And what we found was pretty promising. So following the introduction of a seizure dog, there was a noticeable drop in seizure frequency, and patients had more days without any seizures at all. And overall, the quality of life scores improved with the seizure dog around. So we also observed that for roughly 1 in 4 patients, this approach didn't work out. For example, because their health status or living situation made it undesirable to place a seizure dog or to continue training one. So I would say the main takeaway message from our paper is therefore that the seizure dog may be a solution for some, but not for all who hope to benefit from it.
And it's interesting that the seizure dog actually reduced the seizure frequency, because I would have thought it might add to the safety, but I wouldn't have thought that it would actually reduce seizures. So can you explain a little bit of what a seizure dog can actually be trained to do? Does it just go and alert the caregivers if there's a seizure? Or can it actually help predict that a seizure is going to occur and warn the patient?
Yes, so unfortunately, seizure dog is not a clearly defined concept. So there's not a uniform way in training them either. So in the context of our study, seizure dogs were trained to recognize seizures and to respond in any way that's helpful to the patient. So as seizures manifest differently in different patients, training was not a one-size-fits-all, but rather tailored to the unique characteristics and needs of the patient. But I can give you some practical examples if that's helpful.
Yes.
So for most people when thinking about seizures, the first thing that comes to mind is an episode in which patient falls on the ground and has shocking movements, so the tonic-clonic seizure. And in such instances, the seizure dog can be trained to press an emergency button and hereby activate a system that sets off a sound alarm, but is also linked to the cell phone of a partner or parent. And naturally, seizures are generally brief, so the seizure may have subsided before help has arrived, but it is still considered a valuable task because maybe you've also seen it in your patients, but one of the most persistent fears of people with epilepsy is often that the seizure results in an injury or that the seizure does not stop without intervention. And in such cases, the seizure dog's response may facilitate the rapid medical attention. And to give another example, so some seizures do not come with motor symptoms, but primarily impact awareness. And during such an episode of impaired awareness, the seizure dog can help by forming a physical barrier between the patient and potentially dangerous directions, such as a street, a water source, or a staircase. So I think these are the 2 most common examples of trained behaviors. The training can also be focused on pushing the patient in a recovery position or fetching medication. So it is really the question, what is helpful given the seizure characteristics that we are dealing with? And then, Halley, I think you also referred to the capability of predicting seizures. Mm-hmm. So we are aware that there are organizations that train dogs to provide a warning signal before the seizure occurs. But the seizure dog providers that we worked with did not train this behavior because they believed that the current knowledge of the cues to which dogs respond is not sufficient to train reliably. But we did notice that some dogs appear to provide these pre-seizure warnings spontaneously, so without any training. So for example, they showed changes in behavior by making close eye contact, circling, pawing or barking prior to a seizure. And this was seen in about 1/3 to half of the dogs that were involved in our study. So our patients were made aware that this behavior cannot be guaranteed and should therefore also not be the primary goal of working with a seizure dog. But still, in some instances, we did notice this behavior.
I think it's so fascinating because I've had so many patients tell me that their untrained dog, just their pet, will warn them when they're about to have a seizure. So it's interesting that the dogs can actually do that. So what is the thought about why having a seizure dog would actually reduce the frequency of seizures?
Or the hypothesis is that the stress reduction, which we also observed in our quality of life measures, is closely linked to the reassurance of knowing that the dog is able to provide assistance or call for help when a seizure occurs.
Okay, yeah, so you kind of answered one of my other questions I was thinking is that seizure reduction is occurring through stress reduction. I was just kind of wondering if it would be possible then, like just having a dog can reduce stress, whether it's a seizure dog or not. And how is that different with having a seizure dog? But it sounds like what you're telling me is that it's also stress reduction of just the reassurance of knowing there's some safety plan in place that you have help if you were to have a seizure.
Yeah, so that it remains a theory. So that's what we believe is the most important contributor to the stress reduction. So this question, whether a regular dog would have the same effect, is something that we thought of also. We knew that this was going to be an important question, considering that a seizure dog is cost and time intensive. So we designed the study in such a way that the comparison group, alongside the absence of a dog, also includes observations in the presence of a companion dog or a seizure dog in the initial phase of training. So before the seizure dog can perform the tasks specific to epilepsy. With this methodology, we also attempted to isolate the impact of the dog's formal epilepsy training from merely the presence of any dog. So in fact, around half of the control condition observations were taken in patients who had an untrained or partially trained dog around. So if the question is whether the effects that we observed may extend to regular companion or emotional support dogs, then I would say no, because those dogs more closely resemble control condition than the intervention condition in our study.
Okay, that's helpful because that is another question that I get a lot from my patients, is that they'll ask about getting a seizure dog, but it seems like what they're actually referring to is more of a kind of a therapy dog or emotional support dog. So it sounds like from what you've studied that the therapy dog or emotional support dog may not have as much benefit as a truly trained seizure dog. Is that right?
I think that's right. So the concept of emotional support dog is not something I'm familiar with, because I think in the where country I come from, it's not really a known concept. But I think when you have a patient asking about a seizure dog, given that the term is used not uniformly, it's always good to clarify what skills and what benefits a patient pursues. So I cannot specifically advise on emotional support dogs. But from my understanding of what it is, it may be an alternative worth exploring if the seizure-related disease burden is less pronounced, because the burdens of training and visibility of a service dog may also be lower with these emotional support dogs.
That's true. So I want to go back to something you said earlier about how all seizures are different. So in terms of actually training the seizure dogs, does the patient then need to be involved in the training? And how long does it take to train a seizure dog?
Their training program took about 2 years, in which the first year the focus was on socialization and obedience. So making sure the dog listens to basic commands and can ignore distractions in public spaces. And then the second year was focused on epilepsy-specific tasks. And for this, indeed, it's crucial to attune the training with patient's seizure characteristics and care needs. Usually, this is done by having the patient mimic the seizures so that the dog learns to recognize the unique movements or sounds. But in the first months of epilepsy training, it may also work to have an experienced trainer mimic the seizures based on the descriptions of the seizure or any video material. But in any case, at some point in time, the patient needs to take over, because once the dog masters this task, it may be necessary to continue mimicking seizures when seizures do not occur at a regular basis anymore.
And in your study, you included people who had pretty frequent seizures, 2 seizures per week or more. But would someone with less frequent seizures still benefit from having a seizure dog? It sounds like they're not going to be widely available for everyone with epilepsy. So how do we decide which patients are going to be appropriate for a seizure dog?
If seizures do not occur at such a regular basis, the first question is whether the dog can still be trained on recognizing and responding to seizures. So the seizure dog providers we were working with required a minimum seizure frequency of 8 per month for training purposes. But I know this criterion widely varies among providers, with some requiring more and others requiring less seizures. And then if it were possible to train a seizure dog with the given seizure frequency, I think the second question should be whether the anticipated benefits weigh up to aspects that can be considered as a burden. And with this, I refer to the care and training responsibilities, but also to the impacts of going through life with a dog wearing a vest alongside you. And you would think that the lower the disease burden, the more you may wonder whether the benefits of a seizure dog are worth having to mimic your seizures frequently for training purposes and having your disability made visible to the public through the dog's continuous presence. So I would say in any discussion with patients about seizure dogs, these aspects should be given just as much attention as the anticipated benefits. So a seizure dog is a big commitment and it lasts for about 10 years, a seizure dog partnership. So it really requires a careful consideration of benefits and costs at the individual level.
And I guess too, for the dog's sake, you'd have to make sure that your patient is actually capable of caring for a dog. I mean, they will still need to feed it and manage its medical expenses and everything, right?
Yes, exactly. And that's also why we saw this dropout rate of about 1 in 4. So you really need to have your housing situation, your support network, and also your health capable of caring for a dog.
So how can somebody actually go about getting a seizure dog? And this might be different in different countries. But as a neurologist, can we actually prescribe a seizure dog for our patients? Or how can we help our patients obtain them if we think it's appropriate?
It's really country-specific, but to the best of my knowledge, there's not one country in which seizure dogs are currently part of standard care or reimbursed. And this means that seizure dog providers can determine their own eligibility criteria and also their own fees. So if a patient is interested in obtaining a seizure dog, neurologists can refer them to the seizure dog providers that are active in their country or region and help provide any documentation needed for the assessment of eligibility. And then in terms of financing, patients will then depend on their own savings or any form of crowdfunding or charity donations. So looking at the Netherlands, the costs range between a converted $22,000 to $50,000 for the purchase of the dog and the training program. So unfortunately, the costs will likely form a barrier for patients to obtain a seizure dog in the absence of collective reimbursement.
But now that we have this information, it sounds like that's a good future direction, is to try to get some reimbursement because they can really improve health and quality of life.
Yes, that's what we hope. So it's probably out of the scope time for this episode, but we conducted a much broader evaluation of the potential seizure dogs than we could put in this specific paper that has just been published in Neurology. So we also looked at the impacts on caregiver quality of life. We examined the cost effectiveness and we conducted patient interviews. So I could fill a whole year of a neurology podcast with those topics. But I think it may be important to know that focusing on just the clinical outcomes of seizure frequency, but also even quality of life, I think it really provides a too narrow perspective on the potential of seizure dogs. So there is potential for improving patient outcomes beyond health, for improving health and well-being of caregivers, and also for cost savings. So I think neurologists, but also funding parties may take this into consideration as well.
Great. So that was a lot of really good information about seizure dogs. So to summarize, your research has shown that seizure dogs can reduce seizure frequency and increase the number of seizure-free days and improve the quality of life of people with drug-resistant epilepsy. You can find more information in the publication, which is titled Effectiveness of Seizure Dogs for People with Severe Refractory Epilepsy, Results from the Episode Study. And that's available online now or in the March 26 print issue of Neurology. Valérie, thank you again for joining us.
Thank you, Ellie.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.